Hey everyone, this is Dr. J with Dental Masters of Alexandria, and aging affects every part of our body, including our teeth and our gums. Understanding the changes that take place throughout your life can help you maintain good oral health as you start to age and these changes take place. Here's part 1 of our 5-part series in the life cycle of your teeth. So here are some tips for childhood age 0 to 12. First, I would get your children scheduled for early dental visits, and you should really have your children scheduled by their first birthday. Sometimes we'll say the first time a tooth comes in. That could be pretty early if it's at 6 months. First birthday is a good time unless you see something like a black tooth or you see something that might look wrong. And just getting the child in, even if you go in with your mother or father, and just to be comfortable at the dentist. We don't want your child's first experience to be getting drilled on for a cavity. We want them to see a regular cleaning with mom or dad and feeling comfortable. So good oral hygiene. This starts with the parents. You have to teach your children to brush twice a day using a pea-sized amount of toothpaste. If you can use one that's fluoride acceptable for children, that's great, and supervise. And one trick that I did with my son is I would have him brush and then I would take the brush and go back and check. When he was younger, he actually didn't even know he was missing his entire mouth. And I would go back and brush and say, oh, now it worked a little bit better because I'm a dentist, but you can do the same thing and say, okay, let me go ahead and check. Okay, and give them some encouragement, even though they may not be doing a great job. Okay, we got to get here, get there. So that's something I really recommend doing and making it fun. If it's not fun, they're not going to do it. Healthy diet. So really try to start habits right now of having low sugar beverages. Try to stay away from sodas. Even be careful of your juices like lemonade that are more acidic. If there's apple juice, make sure that there's some water to get it off the teeth. Water is the best beverage you can drink, always. And then snacks like fruit or vegetables are really helpful to get some of the tasty things that are sugary, especially in fruits, and also to help clean the teeth. Age 7, this is something that not everybody talks about. If there's any suspicion at all that the teeth may not be coming in at the right position, and parents, you can ask your dentist for an orthodontic consult. I have another video about this of why, but essentially, if something's happening, catching it early is the best way to prevent way more invasive and costly procedures in the future. So go for an ortho consult. If you feel like there's something going wrong, parents' intuition, and the dentist says, no, let's wait, you can ask and say, can I get an orthodontic consultation, please? The worst that can happen is you go, the orthodontist says, we're okay, let's go ahead and see you back in 3 years. And at best, we can say, oh, we need to go ahead and put an expander in so you don't need jaw surgery when you're older. So it's a win-win. Here's some of the risks that are there, and we've kind of covered them, but let's go back through them in childhood age 0 to 12. So again, dental caries or cavities, common during this time. High sugary consumption, inadequate brushing, regular dental checkups, and fluoride are important to help prevent decay. And remember, a cavity on a baby tooth is one thing, but a cavity on a permanent tooth during that mixed dentition, now you start to develop damage really early on. And the 6-year-old molar is the most commonly lost tooth, and I have another video about that. When you lose that tooth, if you don't replace it, the whole bite can unravel. So really pay attention to that. Thumb sucking and pacifiers. So this is something that's going to occur for infants and toddlers. I would prefer that it be a pacifier because you can take the pacifier away, you cannot take the thumb away. We use pacifiers for quite some time, but you should start to work on getting them away, especially as the permanent front teeth are coming in and you're getting in the ages of maybe 4 and 5, which is usually they should be gone by then. But pacifiers over thumb sucking. Trauma, this is another thing that's not talked a lot, but I remember my son falling a couple times when he was starting to walk. That's why we call them toddlers. And then also there could be sports. So just make sure that you are safe-proofing your house. That's, it's not a video on that, but try to avoid areas where toddlers can fall and bump their teeth. And anybody that's playing sports, have a sports guard made. There's ones that are over the counter, there's ones on Amazon, and you can ask your dentist for one as well. So those are some of the risks. We talked about some of the tips, and this is really the overall for childhood ages 0 to 12. All right, guys, thank you so much for tuning into part 1 of the life cycle of your teeth, and I'll see you next time for part 2. Have a great day.